Hi, Jason Rillo here with Pinnacle's blog. This week's topic is dealing with athletic or sports type injuries. Most of our clients, they have dealt with injuries in the past, or maybe are currently dealing with injuries, and typically they wait too long to do something about the injury. If you're like a professional football player and you get injured, they start doing treatments that afternoon after the injury, and subsequently it improves the healing process infinitely. So the key is to start doing something about the injury right away and not wait to see if it's going to get worse. Just do what you can. So that's really what I'm going to go over today, is the things that you can do immediately to help those injuries occur, or injuries that do occur, help them rehabilitate or get back to working order as quickly as possible. There are so many different modalities that are needed and that are utilized for athletes. I'm not going to really get into them. I'm just going to go over them, and then you can discuss it further with your trainer if you do have an injury or something like that. Or you can at least have the idea of where to seek out the information on the internet through Google or whatever. Sports Injury Clinic, I believe .com, might be sportsinjuryclinic.net is another good place to find out information about specific injuries. The key here is never to self-diagnose. You got to see a specialist about it. Talk to your trainer, and they can refer you on to somebody that can deal with the injury specifically. But you really don't want to self-diagnose, because you may end up doing the wrong modalities or treating it wrong and being counterproductive in your healing process. The real key for almost all injuries, and you pretty much can't go wrong with this, is what the acronym RICE. Most people have heard about it. Rest, ice, compression, elevation. If you do those four things, when an injury first occurs, likely you can't do wrong with that. That's going to definitely help. So if you do those four things, that's a good start. Other key modalities that can be used for injuries are over-the-counter NSAIDs. If you have to do anything stronger, you definitely need to see a doctor. Don't just self-medicate if you've got something left over from before. Acupuncture can help with injuries. Chiropractic for joint and back pain. Those are all things that, and especially with chiropractic, what you got to understand is that if you've had back trouble in the past and you've never seen a chiropractor, or if you have seen a chiropractor but you kind of delay the process in going to see him, you're going to delay the healing process significantly. If you were to injure your back, have a subluxation of the back and your back stiffens up on you, and that same day you see the chiropractor, you could be back to normal within 2-3 days. If you wait a week, it looks like you're going to be another 2 or 3 weeks in order to get back to normal. If it's something that a chiropractor can adjust, they need to adjust it as soon as possible. That will keep your body actively recovering as quickly as possible, and it won't, basically the first process in a back injury, usually in a mild back injury, a subluxation, quote unquote, throw your back out, the first thing that occurs is muscle spasm. Well, if you go see your regular doctor, they typically give you a muscle relaxer. Well, that's counterproductive. The muscle spasm is there to protect the back, and if you don't have it properly adjusted or realigned properly, the injury's still there, and it just has a matter probably to get worse if you're taking a muscle relaxer. Specifically, what I'm going to focus on today is soft tissue injuries. It seems to be that a lot of our clientele have had more soft tissue injuries as of recently, due to things outside of training, things like softball and whatnot, maybe running on their own. And some of the things that you can do for that, in addition to your normal workouts, would be extra stretching of the area. You're going to put ice on it, of course. If anything that's sore probably needs ice. There's some inflammation in there. That's what the soreness is. So you put some ice on it. And then people put heat on it generally too early. Once you're past an inflammation stage, once you're past the first couple of days, you can put heat on it to warm the area. If you wake up in the morning, your back is stiff, heat it up, warm it up a little bit, then do some stretching. The heat is there to provide some pain relief and provide some flexibility so that you can do your other modalities more effectively. Some other things, in addition to stretching, what we call active release technique. Generally performed by a chiropractor or a physiotherapist of some sort. It is a combination of stretching and massage, quite intense massage, but it is extremely effective. In fact, blues players, the official chiropractor for the Rams is Dr. Michael Murphy. That's people who we refer to our clients to. he does ART for the Rams and the Blues, and they do it for St. Louis University and Washington University as well. It's definitely a good technique. I've had it done to me, performed on me many a time, and it is extremely effective. Traditional massage definitely helps. Also, you can do self-myofascial release. It's a complicated process. I'm not going to get into it, but basically, you end up with trigger points in the muscle when a muscle is injured. You strain a hamstring. There's a spot in that hamstring that was injured, and that spot is going to develop scar tissue. That scar tissue will then develop into what we call a trigger point, a point of point tenderness. If you use a foam roller or a golf ball or some other type of pressure inducing modality, it could be a foam roller or something else, something to put pressure on that direct area, and then stretching it, allowing that area to basically warm up, and then doing some stretching, some mild massage that will help release some of that scar tissue and help that area heal. It's extremely effective for plantar fasciitis and for other soft tissue related injuries. So self-myofascial release is something that you need to talk to your trainer about if you notice that you have muscular injuries or injuries that haven't healed correctly. That's something we can show you how to do, and that's really not that technical of thing, and it's something that most likely you can't do wrong and end up injuring yourself. I mentioned foam rollers. Those are good for large areas like the hamstrings. It's hard to massage yourself, or the low back area. That definitely will help warm up the area. It'll help get those muscles and those joints nice and flexible, so that if you see a chiropractor, or if you're going to do your stretching on your own, it'll definitely help with the flexibility in that individual area. A lot of the times when you do stretching, you're stretching the overall length of the muscle. Anytime you add something like a pressure ball or a foam roller, you're able to focus that area of warmth, or that area of warming up, right into a certain area, which then will allow a greater stretch in that one area. Lastly, key point. Runners are especially, they have high incidence of injury due to their running gait. They don't realize that a lot of the times when you have shin splints and you have stress fractures and you have pains in your knees and various things like that, pains in your hips, it is due to your running gait, how you run. Now, it is difficult to relearn how to run through, it's a very long process, and shoes such as Nike's Free shoes will help you learn that process. But more often than not, people just choose the wrong shoe, and then they go choose another shoe, and hopefully they've had a physiotherapist or some other analysis of their gait implement the right kind of shoe that they should be wearing. That does correct the issue artificially, but it's better than running around in the wrong kind of shoe and ending up with all kinds of hip and knee pain. Plantar fasciitis often is due to the wrong type of shoe. Not entirely, but a lot of times the wrong type of shoe. Shin splints, oftentimes wrong kind of shoe. You got overpronation going on in the lower leg, in the ankle area, whether it be after you're tired, or maybe it's just the way you walk and run, just in general. With that occurring, you're going to end up with a lot of lower leg pain, and that just goes all the way up the leg. Again, overpronate at the ankle puts extra stress on the knee. Extra stress on the knee puts extra stress on the muscles of the upper leg and the joints surrounding the upper leg, both the hip joint, knee joint, ankle joint. Everything is being affected by just the way you land, because obviously if the foot's the only thing that touches the ground, if all the rest of the joints or segments going up all the way into the hip are misaligned, you're going to end up with some problems there. So getting that corrected as soon as you feel that pain in your foot, getting some myofascial release, putting some ice on it. If you feel that pain in your knee coming back, icing it, doing the things that you know you need to do. If you know it's due to your shoes, go get some new shoes right away. Don't wait for it to progress. The problem is that if you wait too long, those acute injuries, that injury that bothered you for just a couple days, will turn into a chronic one, and it will bother you for weeks, months, maybe even years. So it's much easier to jump on it right away and get rid of it. We don't want those injuries to become chronic. Unfortunately, people like runners who can't give up the running or don't like to go into an alternative modality like cycling or something like that, they just deal with the pain and they keep dealing with it. We don't want you to deal with it. Like I said, talk to a professional, orthopedic surgeon, podiatrist, physiotherapist, physical therapist. Start with your trainer. Just ask them some questions. The trainer will then be able to pass you on to the person that best fits your problem. If you got any other comments or questions, please let me know. Otherwise, good luck, be safe.